Hello everyone, I'm Peter Harris. I'm President and CEO of FloSpine. Today we are still continuing our launch with Start Engine. You can get involved for as little as $300. So please go to startengine.com/FloSpine to get more information. However, today I'd like to introduce you to one of our products which has been out for a year. This is the Panama Anterior Cervical Plate System. So how this is used, this is when a surgeon needs to put and fuse the cervical spine where patients are having pain in their arms and neck from discs being collapsed. So what the surgeon would do, he'll go in and he'll remove these discs and put in some bone or a cage, and then to hold the spine together, he'll put this plate on with screws. And what's very unique about our plate and screws is that we have a very unique lock-in mechanism. So this gold lock-in mechanism over here prevents the screws from backing out. So he'll put the screw in and then turn the lock-in mechanism. That'll stop the screws from backing out, but the screws can still spin. So what we did, and this is a patented technology we have, we put tiny teeth on the top of a screw and on the underside of a gold lock-in mechanism. So if the screw starts to back out, those teeth will interlock and prevent from the screw turning anymore. Some other features of this is that we have very high screw angulation, which surgeons like, so we can shoot the screw up in the spine. And this is available in different sizes. So we can go do a 1 level, which is just one fusion. We can go up to 5 level plates, where we actually do 5 fusions of vertebra. So please check with us occasionally. We'll bring you updates as we move along. And please check out Start Engine for FloSpine, and we'll talk to you soon. Thank you very much.